4 years ago, I came to California and I said, you know, if every other major country on earth can guarantee health care to all of their people as a right, so can the United States of America. And once again, we were told this is a radical and extreme idea, something the American people will never go for. Well, guess what? Poll after poll after poll shows us that that is exactly what the American people want. What the American people now understand is that it is absurd that we maintain a dysfunctional system in which today 87 million Americans are either uninsured, completely zero insurance, or underinsured with large deductibles and copayments. The American people understand that we cannot maintain a system in which 30,000 Americans die each year because they don't get to the doctor when they should, because they're underinsured or they're underinsured. The American people understand that it is totally grotesque and immoral that this year 500,000 Americans will go bankrupt because they suffered a serious illness and cannot afford to pay their medical bills. The American people, just think about that for a moment. If you are sick, if you're struggling with cancer or heart disease, you got to focus on getting better. That's what your mission is. You should not have to worry about your family going bankrupt simply because you had a serious illness. The American people understand. The American people understand that it is unacceptable that in America we pay the highest prices in the world for prescription drugs. A week ago, Sunday, I was in Windsor, Ontario with a number of people from the Middle West, and we went to Canada in order to purchase insulin. All of the people that I went with were diabetic, and they need insulin to stay alive. We went to Windsor, Ontario, and we bought the exact same vial of insulin that they bought in the United States for 1/10 of the price. And it's not just insulin, it is prescription drug after prescription drug sold in Canada or sold in Europe at a fraction of the price that is sold here in the United States. And the American people are sick and tired of the greed of the pharmaceutical industry. Now, my critics, and by the way, what you are going to see, mark my words on this one, what you will see is the healthcare industry, which made $100 billion last year. You got that? That's the drug companies and the insurance companies alone made $100 billion a year. Profits are soaring for the healthcare industry when so many of our people are unable to go to the doctor or they become bankrupt. These greedy people will spend hundreds of millions of dollars to defeat our effort to pass Medicare for all. And they're going to say, oh, this is so complicated, it's going to disrupt the system. And that is absolutely untrue. It's going to bring stability to the system. What we are talking about, so you all understand it, right now, every single year, 50 million Americans lose the private insurance they have. Whenever you change a job, you likely lose your private insurance. If you quit your job, you lose it. If your employer says, hey, Joe, guess what? We've changed insurance companies. You got a new insurance policy. 50 million people every single year. And what we are simply doing is taking the most popular health insurance program in America, which is called Medicare. All right? We are expanding Medicare benefits for the elderly to include dental care, hearing aids, and eyeglasses. And then in year one, over a 4-year period, this is all that it is. We start off right now, Medicare eligibility is 65. Year one, we cover all of the children. We expand those benefits. We go from 65 down to 55. There are millions of people in this country who are 60, 62, who have no health insurance or inadequate health insurance, who are desperately trying to get into Medicare. Wait till they're 65. We are going to lower that age to 55 first year, 45 second year, 35 third year, and then we cover every man, woman, and child with comprehensive health care. And let me be clear, this is comprehensive health care, including dental care, including mental health care. This is comprehensive health care, which says no more premiums, no more deductibles, no more out-of-pocket expenses. In Canada, if you have a heart transplant, if you have any kind of serious surgery and you're in the hospital for weeks or months, when you come out, there is no bill. That is what a civilized democratic society is about. Under Medicare for all, there are going to be a lot of lies about what we're trying to do. It means the freedom of choice regarding any doctor you want, any hospital you want, any clinic you want. Now, the bottom line here is this really is not a debate about health care, because it is impossible for anyone to defend a dysfunctional health care system in which we spend twice as much per person as do the people of any other country, and yet we have so many people uninsured, underinsured, and we pay outrageous prices for prescription drugs. Nobody can defend that. So what this is all about is whether we have the capability of standing up to the greed of the healthcare industry, which made $100 billion in profits last year. That is what this struggle is about. And what I believe, and I know you believe, is the function of healthcare is to provide quality care for all, not making the insurance companies and the drug companies unbelievably rich. And when I look at health care, I see it as a human rights issue.
You know, Bernie's Medicare for All bill would guarantee health care to all, significantly reduce the amount of money we spend as a country on health care, and save the many people we lose per year due to lack of coverage. It's honestly a no-brainer. And many Americans do support it. And yet, Medicare for All still faces fierce opposition from the drug companies, the insurance companies, and thus seemingly most of our representatives in Washington. They try and paint Medicare for All as some radical idea and act as if it would cost too much money, even though quite the opposite is true. There are already a lot of countries around the world that guarantee health care to all of their people as a right. But as you probably know, we do not. And as a result, we sadly lose a lot of people per year due to lack of coverage. Moreover, a less broached aspect of the healthcare debate is that a lot of people go bankrupt due to medical expenses, which would not be a thing if we joined the many countries around the world and guaranteed healthcare to all of our people as a right. In truth, if we did, nobody would go bankrupt because everybody would be covered. You know, it is just beyond unbelievable to me the greed of the drug companies and the health insurance companies in this country. I've said it many times before, and let me say it again. Money in politics is one of, if not the biggest issue that we face in America today. Money in politics enables the wealthy to buy politicians and favors, and they do, a lot. For instance, in 2018, a pharmaceutical lobby spent $27.5 million on lobbying in 2018 alone. If you don't understand why drug prices are so high in America, this is why. In fact, did you know that we actually spend by far more per person on healthcare than any other country on earth? And that includes all of the countries that already have universal healthcare. If so many countries are able to guarantee healthcare to all of their people as a right, spending significantly less, then we should be able to too. Healthcare should be a human right. And it's beyond time that we as a people finally join the many countries around the world and guarantee healthcare to all of our people as a right.